Okay, now it's getting to a point where it's giving me resistance. So I get it out of the crucible. And basically, I just roll it into a hot dog of acrylic. And I mold it around the mounted model. That we want to finish it to. I'm going to let it stay there for a second, and you can pan in on that if you want to. And this is a dual appliance technique, so I've already made the appliance for the upper jaw, and I'm going to lubricate it with just some petroleum jelly. And I've got a little bit too much, as is the case much of the time. Let me get a towel, wipe off the excess. So right now, I'm just going to continue to mold this a little bit. Now, this acrylic is really good. When you slow down the reaction in the cold water, you've got a little bit of working time. So what I want to do is I want to take a scalpel blade, and I'm going to go along close to the tooth and gum line, close to the CEJ, which is a cemental enamel junction on the model. But for those of you who are not in the dental profession, we go to about the gum line at first. Don't try this at home. I'm used to whittling with scalpels, and I wouldn't recommend that. Turn away if this makes you squeamish. Okay, so right now that's what I'm going to do. Now, it's still pliable, as you can see. So this is put back on the working articulator. Now, working articulators usually don't look fancy because they do a lot of model work in any given day. So they have stone on them, the paint will come off, all of this kind of stuff. So I wouldn't be concerned about the looks here. But right now, I am press fitting this material to that upper model on a programmed mechanical jaw. And then, once I get that impression in that doughy acrylic, as this is starting to get hot, and it is, I continue to press it against the model because it will try to flare away a little bit. You can see that. Okay, so this particular resin needs a lot of hand work. And now it's getting warm, but it's not hot. But what I'm doing is I'm just continuing to tell it memorize the tooth surfaces. That's all I'm doing with my fingers. And as it starts to heat up, it starts to shrink wrap around those teeth, and it's getting warm. Not too hot, but warm. And I'm not going to let go of it until I can't stand it anymore. Because I don't want it springing away from the tooth and setting in a sprung fashion, meaning where it's flared away from the teeth. So now it's getting to a point that it's lost its sponginess and it's getting really warm to the touch. So now it's lost its springiness, but as you can see, it's conformed pretty well to the model. And now it's so hot and it's not moving, I can't do anything more with it, but now I put it back into a water bath of cool water to slow down the reaction, because keeping an exothermic reaction from overheating means you have less distortion in the final product, so it will snap on in place in the person's mouth, which is what you want. You want it to be able to snap in and then lightly snap out.